In furtherance of the state government's effort to ensure no resident is left behind in health insurance coverage, a new relationship between the Ubulu Kingdom in Unor South local government area of Delta State and the Delta State Contributory Health Commission has been formed. Upon arrival at the premises of the Delta State Contributory Health Commission in Asaba, the capital city, the traditional ruler of the kingdom, Obi Kikachukwu Henry Afamifuna, and his team were received by the chairman of the commission, Dr. Austin Obidi, and the Director General and Chief Executive Officer, Dr. Isaac Akpoveta. Meeting with the DG and management staff of the commission, Obi Henry Kikachukwu said the visit was to appreciate Dr. Akpoveta for his commitment to serving humanity and to extend hands of friendship to him, noting that he was proud of Dr. Akpoveta. Obi Kikachukwu, who is also the second vice chairman of the Delta State Council of Traditional Rulers, said he had watched with keen interest the passion with which Dr. Akpoveta performed his duty and carried out his activities across the 3 senatorial districts without bias, even as he described him as a community builder, a banner, a humanitarian with high regard for the traditionals too.
At this critical time, I have seen people with health challenges, and there is no treatment. You can, even the small malaria, there's no treatment you can actually effect with 7,000. So for government to have done that, providing a kind of subsidy to the indigent persons to take care of their health, I think they have done so much to assist the poor. And for finding some persons who are so committed, like the person of Ororogu, Dr. Isaac Akpoveta, who is the current Director General of the scheme, as well as the current chairman of the scheme. I thank His Excellency for believing in them. And actually, if you go out there, you will discover that a lot of communities have hidden into the scheme. And I believe it will impact positively to the lives of our people. We cannot thank His Excellency enough. We will continue to let the people know in the village that such a scheme exists, such that they can benefit from it.
In his response, Dr. Akpoveta said out of the estimated population of 5.6 million, over 2.4 million residents of Delta State had been registered into the state health insurance scheme, with Delta State Health Insurance ranking first in Nigeria and in West Africa. Attributing the successes recorded in the scheme so far to the support of Governor Burowori, he said the state government has spent over 10 billion naira in subsidizing health bills for residents of the state. The commission's DG, who expressed happiness at the visit, intimated the traditional ruler of Ubulu and his team on the benefit packages and plans of the state insurance scheme, including the Indigent Enrollee Adoption Initiative, which provides platform for high-net-worth individuals to purchase health insurance for the underprivileged around them, and urged the monarch to key into the initiative.
And as the second vice chairman of traditional rulers in the whole of Delta State, and my friend, then we are going to drive this together. The day I'm going to drive you, if you stand up and talk to your colleagues and show an example of people in your kingdom that have already purchased, and so it will go like whatever. After the second tenure, Delta should have achieved what we call universal health coverage.
The President General of the Unified Ubulu Development Association, Professor Jeff Mokobia, harped on the need to intensify awareness on the activities of Governor Burowori to enable more Deltans appreciate the MORE agenda, even as he promised to key into the insurance scheme.
To get to my people will enlighten them. They have to know about it. It is when you know about something, you are convinced about it. So the first task we're going to do is to talk to them about it and let them know that it's real. It's not a farce. And I can assure you that many of them will key into it. Like it's been said, today you cannot treat a common malaria with 7,000. I remember my last experience, I treated my ward. The minimum I spent was 16,000. I was shocked. So I think it's a very laudable scheme, and we'll key into it.
High point of the visit was the presentation of information, communication and education materials of the Commission to the visitors by the Commission's DG. Eunice Emeazia reporting.